May is Arthritis Awareness Month and National Osteoporosis Awareness and Prevention Month. Sometimes called degenerative joint disease or wear and tear arthritis, osteoarthritis is the most common chronic condition of the joints. It occurs when the cartilage or cushion between joints breaks down, leading to pain, stiffness, and swelling. According to the Arthritis Foundation, by the year 2030, an estimated 67 million adults age 18 years and older will have doctor-diagnosed arthritis. 2/3 of those with arthritis will be women. Rheumatoid arthritis is a systemic disease characterized by the inflammation of the membranes lining the joint. Medications prescribed for the treatment of RA can trigger significant bone loss. In addition, pain and loss of joint function caused by the disease can result in inactivity, further increasing the osteoporosis risk. Of concern is the fact that women, a group already at increased risk for osteoporosis, are 2 to 3 times more likely than men to have rheumatoid arthritis as well. We spoke with a specialist at the Center for Medical Imaging about the important role imaging plays in diagnosing arthritis and osteoporosis.
Probably the 3 most common types of inflammatory arthritis that we see in our clinical practice is rheumatoid arthritis, psoriatic arthritis, and erosive osteoarthritis. And it's an important arthritis in that the clinical course of these patients is often very rapidly progressive if left untreated. Patient with inflammatory arthritis may become disabled and have significant deformity and disability rather quickly if untreated. If we can diagnose patients with inflammatory arthritis earlier and start aggressive therapies aimed at halting or slowing disease progression, then these patients are going to do much better. They're not going to have as much bone destruction, as much deformity, and as much disability.
There is a lot of concern as the population ages and live longer that you do lose bone mass, the calcium, and because of that people get fractures, which can be very debilitating when you're older. And what we're able to do now with the advent of new medications, we can actually treat this and reverse the loss of bone calcium and prevent fractures that frequently occur in the elderly that can be very devastating. And we can monitor this and see who needs the treatment and how well the treatment is doing with bone density measurements. We're able to do this here, and it's a very simple test, painless. You basically lay down on a table for a couple of minutes, and a very low dose X-ray picture is taken, and the computers do the work, let us know what the density of the bones are. By treating for bone loss early, we can make sure that as the population, as a person ages, that they can still maintain a very healthy, active lifestyle. The more active a person is, they're more likely that they are going to have some type of minor trauma. As long as they don't have osteoporosis, their bones will be able to withstand the minor trauma. Frequently with people who have severe bone loss, minor trauma can cause devastating fractures.
For information on the board-certified radiologists at the Center for Medical Imaging, or to find out more about their numerous imaging procedures, please click the Female Diagnostics story link on our homepage at yourhometownhealth.com.